Let's discuss the extraordinary vessels, principles, and functions. The primary channels are the rivers. The extraordinary vessels are the lakes. In some of the classics, the extraordinary vessels are compared to reservoirs which stores excess yang, yin, qi, or blood, releasing it into the primary channel system in times of need. With the exception of the renmai and dumai, they do not have their own points, but they can be accessed through and are connected by points on the primary channels. Okay. All extraordinary vessels, with the exception of Daimai, with its horizontal trajectory, begin at the lower extremities or in the lower part of the torso and travel to the head. They can be activated by needling their opening and coupled points. Reservoir and compensation function. When the network vessels, the primary channels, are filled to overflow, none of the conduits could size any of their contents, and it is only then that the surplus contents of these vessels flow into the single conduit vessels, the extraordinary vessels. The Nanjing compares the extraordinary vessels to reservoirs, which are able to absorb a surplus of qi and blood in the primary channels, releasing them again during periods of deficiency. For example, if pathogenic factors penetrate the primary channel system, this excess can be absorbed by the extraordinary vessels. This will ensure that the Sangfu organ remain unaffected. In that sense, the extraordinary vessels have a regulating compensation function. Next, in reproduction and fertility, the Chongmai and the Renmai in particular, but also the Dumai, play an important role in reproduction and fertility. Connecting the primary channels, the Chongmai, also known as the Sea of the 12 primary channels, connects the primary stomach and kidney channels. It also strengthens the connection between the Renmai and Dumai. The Renmai, as the Sea of Yin, connects all yin channels. The Dumai, as the Sea of Yang, connects all yang channels at Du 14. The Daimai circles the body at the waist and binds the vertical trajectories of all 12 primary channels in general, but especially the Chongmai, the Renmai, and the kidney, liver, and spleen channels. The Yin Wei Mai dominates the interior of the body and connects the kidney, spleen, and liver channels on the Renmai. The Yang Wei Mai controls the exterior of the body and connects the bladder, gallbladder, triple burner, SI, and stomach channels and the Dumai. The Yin Chao Mai connects the kidney and bladder channels and controls balance. The Yang Chao Mai connects the bladder, GB, SI, LI, and stomach channels and control activity. In addition, the 8 extraordinary vessels are regarded as connecting channels for the extraordinary food organs. Protection of the body, the Chongmai, Renmai, and Dumai circulate the defensive qi, Wei qi in the thorax, abdomen, and the back, and thus help to protect the body against external pathogenic factors. Due to their origin, they are also directly linked to the kidneys, the pre-heaven qi, and the constitutional forces. Comparison of the 8 extraordinary vessels with the primary channels. So we have the primary channels and the 8 extraordinary vessels, point trajectory, specific bilateral points. In 8 extraordinary vessels, only the Renmai and Dumai have their own points and the internal pathways. All other extraordinary vessels borrow points from the primary channels. The 4 central vessels are unilateral except for the Chongmai, which also has a pathway on the extremities. The 4 peripheral vessels are bilateral. Next, in circulation, the primary channel continuously circulate nutritive qi and blood. In 8 extraordinary vessels, circulate essence qi, nutritive qi, and defensive qi, but according to some authors, they do not have a continuous flow of qi. Next, in depth, the primary channels, we have the superficial external pathway and the deeper internal pathway directly connected to their pertaining Sangfu organ. In 8 extraordinary vessels, compared to the internal pathway of the primary channel, they are more superficial compared to the external pathway of the primary channels. They are deeper. They have no direct connection to the Sangfu organs, but their origin, especially of the 4 central vessels, lies deep within the body. Next, in connection, the connections, the primary channel, they connect the exterior and interior through internal, external pathway and through yin-yang channel, as well as above and below hand-foot pairing axis. In 8 extraordinary vessels, they do not connect the interior with exterior, nor do they connect yin and yang. Next, we have the function. The primary channel guide access to the 8 extraordinary vessels or to other secondary channels. The 8 extraordinary vessels reservoir function, excessive qi and blood in the primary channel flows to the 8 vessels and are stored there. In times of deficiency, they are transported back into the primary channels. Next, in diagnosis, the primary channel, diagnosis have on-channel theory, meridian therapy, in TCM according to the Bagang, Sangfu, pulse, and tongue. In 8 extraordinary vessels, diagnosis is characterized by specific arrays of symptoms and specific causes. Thank you for your attention.
Let's discuss the liver primary channel. The liver primary channel begins at liver 1 on the lateral corner of the nail of the big toe. This point is reached by a small branch of the GB channel, which separates from the gallbladder primary channel on the dorsum of the foot at GB41, the foot yin-yang connection of the third grade circuit. The external pathway runs proximally between the first and second metatarsal bones, ascends anterior to the medial malleolus, then crosses the spleen channel at spleen 6 on the medial aspect of the lower leg, ascends the medial aspect of the leg towards the knee anterior to the spleen channel, continues along the medial aspect of the thigh to the pubic region where it passes spleen 12 and spleen 13, circles the external genitalia, ascends the lower abdomen passing REN 2, REN 3, and REN 4, obliquely traverses the abdomen to liver 13 at the free end of the 11th rib and to liver 14 where the external pathway terminates. At liver 13, the channel enters the abdomen, marking the beginning of the internal pathway. It circles the stomach, connects with its pertaining Zhang organ, the liver, and its paired Fu organ, the gallbladder, penetrates the diaphragm, spreads in the lateral hypochondrium and thoracic region. The channel then ascends along the posterior aspect of the trachea to the throat and nasopharynx and connects with the eye system and the brain. It crosses the forehead and ascends to the vertex where it connects with the extraordinary vessel Dumai at Du20. An internal branch descends from the maxillary sinus to the cheek and circles the inner surface of the lips. An internal branch emerges from the liver, penetrates the diaphragm, disperses in the lung, and meets the lung primary channel. This is the deep yin-yin connection, closing the first circuit of the nutritive qi. This branch further connects with the pericardium primary channel beneath pericardium 1, hand-foot pairing of the third grade circuit, yin axis, Jue-yin. Clinical importance of knowing the liver primary channel. If it is an exterior condition, there would be headaches, dizziness, blurred vision, tinnitus, fever, and spastic extremities. If it is an interior or Zhangfu organ situation, there will be distension, fullness and pain in the costal region, tightness and fullness in the chest, abdominal pain, vomiting, jaundice, diarrhea, Shan disorder, enuresis, urinary retention, yellow urine. Connections of the liver primary channel. With the gallbladder primary channel, connection is foot yin-yang pairing of the third grade circuit. Location, GB41 to liver 1 on the foot. Circulation is circadian according to the organ clock. Importance, exterior-interior relationship. Then it also connects to the pericardium primary channel, paired according to the six-channel theory, the hand-foot pairing, yin axis of the third great circuit. Location, liver to pericardium. An internal branch originating in the liver penetrates the diaphragm and connects with the pericardium primary channel beneath P1. Circulation is non-circadian. That means it's not according to the organ clock. Importance, above-below relationship. With the lung primary channel, the liver is connected via the deep yin-yin connection. Location, liver to the lung in the thorax. An internal branch originating in the liver penetrates the diaphragm and disperses in the lung to connect with the lung primary channel. Circulation is circadian according to the organ clock. Importance, the lung primary channel receives part of its nutritive qi from the liver primary channel. This is the first circulation of the yin qi. Connections with Zangfo organ systems, stomach, liver, gallbladder, and lung. So the liver primary channel points affect the inner aspect of the leg, abdomen, hypochondrium, throat, and head. Important distal points for headaches from liver yang rising. Invigorate blood, especially in the uterus. Several important points for urinary problems. Several important points for genital problems. The liver channel, this is a recap. The liver channel starts on the big toe and runs upwards on the dorsum of the foot and medial malleolus, and then up the medial aspect of the leg. It then reaches the genital region, curves around the genitalia, and goes up to the lower abdomen. Proceeding further up, it curves around the stomach and enters the liver and gallbladder. It then continues to ascend, passes through the diaphragm, and branches out in the hypochondrial and costal region. From here, it ascends to the throat and reaches the eye. Running further upwards, it goes to the top of the head to meet the governing vessel. Thank you for your attention.
Let's now talk about the renmai, or the conception vessel pathway. The renmai is synonymous with conception vessel. It has two relationships. One is with its yin-yang pair. Renmai is paired with dumai. Second pairing is the central peripheral relationship. Renmai is paired with the yin chao mai. Regions supported by this pairing are as follows: the face, throat, thorax, lungs, diaphragm, and abdomen. Its opening point is lung 7 and coupled with kidney 6. Now let's explore its pathway. The extraordinary vessel renmai originates like the chongmai and dumai in the lower abdomen, or according to some authors, at the kidneys, and then connects with the urogenital area and emerges at the perineum at Ren 1. From there, the external pathway ascends the anterior midline, passing the abdomen, the chest, and the throat. It terminates on the chin in the mentolabial groove at Ren 24, where it meets the stomach primary channel and the extraordinary vessel dumai. From here, the vessel continues internally, encircles the inner surface of the lips, and connects with the dumai at Du28 beneath the upper frenulum. It divides into two branches, which both reach the infraorbital ridge at stomach 1, where they cross the stomach primary channel as well as the extraordinary vessel yin chao mai and terminate near the eyes. An internal branch runs from the perineum to the spine, penetrates the spinal canal at Du1, and ascends in the spine. For its connections with other channels and organs. For the channels, renmai is connected with dumai, the chongmai, kidney, and stomach primary channels, and the kidneys. Clinical importance. As the C of the yin qi, it regulates and circulates the yin qi, including blood, essence, and body fluids, in order to nourish and moisten the body. It connects all yin channels, especially those of the lower abdomen. It controls the anterior thoracic region and the abdomen. It has close relationship to the functions of the abdominal organs, particularly the kidney, bladder, uterus, and lung. It regulates reproduction. It stores the essence qi overflowing from the yin channels and absorbs excess from yin channels, especially stagnant qi and blood. Here are some notes about the renmai. Both the renmai and dumai have a unique position among the 8 extraordinary vessels. They are the only 2 extraordinary vessels with their own specific points. All other extraordinary vessels can only be accessed through points on the primary channels. For this reason, the renmai and the dumai, together with the primary channels, are often categorized as 14 channels. However, from the point of view of channel energetics, this is not correct, since the extraordinary vessels occupy a special position, both evolutionary as well as functionally. The pathway of the renmai, like that of the dumai, is limited to the torso and the head. While it does not course along the extremities and does not have any points on the limbs, neither general points nor specific points such as the 5 shoot transporting points, UN source points, and others. It does have an opening point or a master point. The renmai is also referred to as the sea of yin and governs the yin in the whole body. Along its pathway are located the anterior aspects of the energy centers or chakras according to the Yugi tradition. Taoist tradition describes 3 energy centers, the 3 cinnabar fields, or the dantian, on the anterior aspect of the body, which plays an important role in Qigong practice as centers where the Qi pools and originates. While all 3 centers are located on the pathway of the renmai, they do not correspond to specific points, but rather to certain areas. The renmai runs along the inside of the body. It contains not only several frontmai points acting directly on the zangfu organs, but also multiple meeting points with other channels. This clearly denotes the outstanding importance of the renmai. Here are some specific points according to their function. As mentioned earlier, no points are ascribed as UN source point. The Lu connecting point of the renmai is Ren 15. There is no Shik left point, no associated back shoe and associated front mouth points. There are also no 5 shoe transporting points. As for the Hui meeting points, we have as follows. Of the Qi, we have Ren 17. The Hui meeting point of the 4 organs is Ren 12. Pertaining opening point is lung 7. Pertaining coupled point is kidney 6. There is no lower Husi point. As for the Jiawei meeting points, we have as follows. With the Chongmai and Dumai, we have Ren 1. With the liver channel, Ren 2. With the spleen, liver, kidney channels, we have Ren 3 and Ren 4. With the Chongmai and kidney channels, we have Ren 7. We have with spleen and stomach channels is Ren 10. With the SI, triple burner and stomach channel is Ren 12. With the stomach and SI channels, we have Ren 13. With the spleen, kidney, SI, and triple burner channels, we have Ren 17. With the Yin Wei Mai, we have Ren 22 and Ren 23. With the Du Mai and Lung and the LI and stomach channels, we have Ren 24. Of other channels with the Renmai, we have Du 28, stomach 1, and Du 1. No point is ascribed as the Gao Wu command point. As for the window we have in point, we have Ren 22. The point of the 4 Cs is Ren 17. This is for the Qi. No point is ascribed as the Madanyang heavenly star point. For the Sun Si Miao ghost point, we have Ren 1 and Ren 24. Other functional points. The front midpoint of the bladder is REN 3. Front midpoint of the small intestine is REN 4. Front midpoint of the triple burner is REN 5. Important general tonification point is REN 6. Front midpoint of the stomach is REN 12. Front midpoint of the heart is REN 14. An important coming point is REN 15. Front midpoint of the pericardium, which is also the point of the Sea of Qi, is REN 17. Thank you for your attention.
Let's discuss the girdling vessel pathway. Synonyms is girdling vessels. The extraordinary vessel, daimai, is the only vessel or channel with horizontal pathway except for Lu connecting vessels. Relationship, yin-yang, chong-mai, daimai. Central peripheral, daimai, yang-wei-mai. Region supported by this pairing, lateral eye region as well as the temporal region, ears, cheeks, occiput, and shoulders. Opening point, GB41, coupled point, TB5. Pathway. The extraordinary vessel, daimai, originates in the hypochondrium at the level of L2. According to many other authors, it originates at liver 13, at the free end of the 11th rib. It encircles the waist of the body like a belt. As it does so, it passes GB26 at the level of the umbilicus and below free end of the 11th rib, GB27 and GB28. Meeting points with other channels. Liver 13, anterior and inferior to the free end of the 11th rib. GB27 in the depression medial to the anterior superior iliac spine, approximately level with REN 4. GB26 on the lateral aspect of the waist at the junction of the vertical line through the free end of the 11th rib, and a horizontal line through the umbilicus approximately 1.8 June inferior to liver 13. GB28 anterior and inferior to the anterior superior iliac spine, 0.5 June anterior and inferior to GB27. Connections with the other channels, organ, gallbladder and liver primary channels, kidney divergent channel, kidney uterus. Clinical importance, control and encircles the horizontal channels like a belt, connects the upper and lower hubs of the body at the waist, regulates vaginal discharge, eliminates damp heat from the lower burner, especially from the genitalia, controls the Qiao-yang channel, especially the GB channel. Thank you for your attention.
Let's now discuss the yin-wei-mai, yin-linking vessel pathway. Relationships. The yin-yang relationship is yin-wei-mai with yang-wei-mai. Central or peripheral, chong-mai with yin-wei-mai. Region supported by this pairing, heart, thorax, stomach. Opening point, P6, coupled point, spleen 4. The extraordinary vessel, yin-wei-mai, originates in the hypochondrium at kidney 9. 5 Sun, proximal to the prominence of the medial malleolus, ascends the middle aspect of the leg to the inguinal region, follows the spleen and liver primary channels, passing the points spleen 12, spleen 13. It then passes spleen 15 and spleen 16, and again meets with the spleen and liver primary channels at liver 14. The vessel then traverses the thoracic region, passes REN 22 in the suprasternal fossa, and follows the extraordinary vessel REN-mai to REN 23. Where it terminates. Meeting points with other channels, kidney 9, 5 Sun proximal to kidney 3, and 2 Sun posterior to the middle border of the tibia. Spleen 12, 3.5 Sun lateral to the midline, level with the upper border of the pubic symphysis lateral to the femoral artery. Spleen 13, 4 Sun lateral to the anterior midline, mammillary line, and 0.7 Sun superior to the upper border of the pubic symphysis. Spleen 15, 4 Sun lateral to the center of the umbilicus. Spleen 16, 3 Sun superior to the center of the umbilicus, and 4 Sun lateral to the anterior midline on the mammillary line. Liver 14 is in the 6th intercostal space on the mammillary line 4th zone lateral to the midline. REN 22.5 zone superior to the sternum in the center of the suprasternal fossa. REN 23 on the anterior midline superior to the upper border of the hyoid bone. Connections with other channels, kidney, spleen, and liver primary channels, Ranmai, and the internal organs. Clinical importance of yin wei mai connects and regulates all yin channels of the body. It connects the kidney, spleen, and liver channels and the Ranmai and dominates the interior of the body, the internal organs. Strengthens yin and heart blood, especially in women, balances emotions. Thank you for listening.
Let's now discuss Yang Wei Mai, or the Yang linking vessel pathway. First, we discuss about its relationships. On a yin-yang pairing, Yin Wei Mai is paired with Yang Wei Mai. For the central peripheral pairing, Yang Wei Mai is paired with Dai Mai. Regions supported by this pairing are as follows: the lateral eye region, temporal region, ears, cheeks, neck, and shoulders. Its opening point is triple burner 15, and its coupled point is GB41. And now let's go to its pathway. The extraordinary vessel Yang Wei Mai originates at bladder 63 in the depression posterior to the tuberosity of the 5th metatarsal bone, runs anterior to the lateral malleolus, passes gallbladder 35, ascends to the lateral aspect of the leg, passes the hip, ascends to the posterior aspect of the costal region to the shoulders, passes SI10, triple burner 15, GB21, and ascends the neck. The vessel then ascends anterior to the ear, which according to some authors, for example, is posterior to the ear, to the forehead, passing stomach 8 and gallbladder 13 and gallbladder 14. It then runs with gallbladder channel from GB15 to 20 on the occiput, passing GB15 and GB16 to GB17, 18, 19, and GB20. The vessel then continues from GB20 to the posterior midline, passing DU16 and DU15, where the vessel terminates. Here are the meeting points with the other channels. First, we have bladder 63. It is located in a depression anterior and inferior to bladder 62, between the calcaneus and the cuboid bone, proximal to the tuberosity of the 5th metatarsal bone. Next we have SI10. It can be found with the arm adducted on a line extending in a superior direction from the posterior axillary fold on the lower border of the scapular spine. Another point is GB35, which is 7th zone proximal to the highest prominence of the lateral malleolus on the posterior border of the fibula. Next, we have triple burner 15, which is located at the midpoint of an imaginary line between the spinous process of the 7th cervical vertebra and the lateral extremity of the acromion. Next points, we have GB21. It can be found at the highest point of the shoulder, midway between the lower border of the spinous process of the 7th cervical vertebra and the lateral extremity of the acromion. Next is GB13, which is 3 tune lateral to DU24 on the midline, 0.5 tune superior to the anterior hairline. Next to here we have stomach 8. It is located at the temporal corner of the forehead, on the border of the temporalis muscle, and 0.5 tune within the anterior hairline, or 4.5 tune lateral to the anterior midline, or DU24. Next, we have GB15. It is located when looking straight ahead, superior to the pupil, 0.5 tune superior to the anterior hairline. Next point, we have GB16. It is located 1.5 tune superior to the anterior hairline on the pupil line, or 2.25 tune lateral to the midline, which is equal to the midway between do24 and stomach 8. Next point is GB18. It is located 4 tune superior to the anterior hairline or 1 tune anterior to the do20, 2.25 tune lateral to the midline. Next point is GB17. It is located 2.5 tune superior to the anterior hairline and 2.25 tune lateral to the midline. Next point is GB19. Can be found on the occiput level with the upper border of the external occipital protuberance or do17, 2.25 tune lateral to the midline. Next points, we have GB20 on the lower border of the occipital bone in the depression between the origins of the sternocleidomastoid and the trapezius. Next point is do15. It is located on the occiput on the posterior midline in a depression between the first and the second cervical vertebra, approximately 0.5 tune below do16. The last point is do16. It is located on the posterior midline, directly below the external occipital protuberance in the depression between the origins of the trapezius. Connections of the yang wei mai with other channels and organs. It has connections with the bladder, the gallbladder, the stomach, the small intestine, the triple burner, and the large intestine primary channels, and with the dumai. For its clinical importance, the yang wei mai connects and regulates all yang channels of the body. It connects with the bladder, gallbladder, stomach, SI, triple burner, and large intestine channels, as well as the dumai, and controls the exterior of the whole body, especially the taiyang and shaoyang channels. It harmonizes the nutritive qi or the yin qi and the defensive qi or the wei qi. It expels the exterior wind cold, especially with shaoyang syndrome. Thank you for your attention.
Okay, let's discuss the yin qiao mai, yin stepping vessels, the pathway. Yin qiao mai relationship. Yin and yang, yin qiao mai, yang qiao mai. Central peripheral, yin mai, yin qiao mai. Regions supported by this pairing. Face, throat, thorax, lungs, diaphragm, abdomen. Opening point, kidney 6, coupled point, lung 7. Pathway. The extraordinary vessel yin qiao mai originates at kidney 2, inferior to the navicular tuberosity according to some authors. It only begins at kidney 6, runs to kidney 6 and kidney 8, ascends to the posterior medial aspect of the leg to the external genitalial region, ascends to the abdomen to the thorax, crosses the supraclavicular fossa, and continues to the throat and face. It then runs to the inner canthus of the eye, where it connects with the bladder primary channel and the yang qiao mai at bladder 1. It then ascends to enter the brain. So we have here the meeting points with other channels. Kidney 2 in a depression at the anterior inferior border of the navicular bone at the border of the red and white skin. Kidney 6 in the depression inferior to the highest prominence of the medial malleolus over the joint space between the talus and calcaneus. Kidney 8, 2 tune proximal to the highest prominence of the medial malleolus posterior to the border of the tibia, and the bladder 1 in a depression 0.1 tune superior and medial to the inner canthus of the eye. Connections with the other channels, organs, kidney and bladder primary channel, brain. The clinical importance, together with the yang qiao mai, controls the musculature of the lower extremities. Together with yang qiao mai, regulates the opening and closing of the eyes, regulates the functioning of the brain, removes stagnation of qi, blood, or dampness in the lower burner, especially in the uterus in women. Thank you for your attention.
Let's now discuss the patterns under cough. We have wind cold invasion and wind heat invasion. For exterior patterns, we shall be covering the following: invasion of wind cold, invasion of wind heat, and invasion of wind dryness. For interior patterns, we have lung heat, lung phlegm heat. So let's start with invasion of wind cold. Clinical manifestations: cough, slight breathlessness, sneezing, runny nose with white discharge, aversion to cold, shivers, no temperature or one that is only slightly raised, no sweating, body ache, stiff neck, headache, and pale urine. Tongue, there may be no evident change. Pulse is floating tight. This is the typical pattern of invasion of wind cold with prevalence of cold. It corresponds to the Greater Yang pattern with the prevalence of cold within the 6 stages. It is a common pattern in acute cough. Treatment principle: release the exterior, restore the diffusing and descending of lung qi, expel wind, scatter cold by promoting sweating, and stop cough. Lung 7, bladder 12, bladder 13, Li4, kidney 7, lung 6. Reducing method is used. Cupping is applicable on bladder 12 and bladder 13. Lung 7 releases exterior, restores descending of lung qi, and stops cough. Bladder 12 expels exterior wind and releases exterior. It is very effective with coughing. Bladder 13 releases exterior, restores the descending of lung qi, and stops cough. Cupping is also applicable on this point. Li4 is reduced and kidney 7 is reinforced. In combination, promote sweating to release exterior. Lung 6, accumulation point or she cleft point, stops acute cough. Next, we have invasion of wind heat. Clinical manifestations: dry cough with a tickling sensation in the throat, aversion to cold, shivers, fever, sore throat, slight sweating, body aches, headache, runny nose with yellow discharge, sneezing, slight thirst, and slightly dark urine. Tongue, slightly red sides and or front part. Pulse, floating rapid. This is a common pattern in acute cough, especially in children. Treatment principle: release exterior, expel wind, clear heat, restore descending of lung qi, and stop cough. Points: lung 7, bladder 13, Li4, bladder 12, Li11, lung 11, do 14, lung 6. All needled with reducing method. Cupping applicable to bladder 12 and bladder 13. Lung 7 and bladder 13 release exterior, expel wind, restore descending of lung qi, and stop cough. Li4 expels wind heat. Bladder 12 releases the exterior. Li11 expels wind heat. Lung 11 expels wind heat and is used if the throat is sore and the tonsils are swollen. Do 14 is used if symptoms of heat are pronounced. Lung 6, accumulation or she cleft point, stops acute cough. Thank you everyone for your attention.